So good day, ma'am. I am Aubermina Bres. I'm your student nurse for today. So ma'am, I would like to ask if you are Miss Kia Claire. Okay, ma'am. And for today, ma'am, I will be assessing your skin, hair, and nails for your mental and physical condition. So, in assessing the appearance and mental status, the first thing to do is to observe body build, the height and weight in relation to the client's age, the lifestyle and health, or any health activities for the client. So then, after observing the height and weight for the client, so the second is observe the client's posture and gait, standing, sitting, and walking. So, instruct the client to stand and sit. Ma'am, can you stand please? Okay, ma'am, can you please sit down po? After instructing the client to stand and sit, you would also ask the client to walk. While the client is walking, you should be in front of the client. So, ma'am, can you walk please? So, after, can you please sit down, ma'am? So, after instructing the client to walk, and after that, you should observe the client's overall hygiene and grooming. Relate this step to person's activities and prior to the assessment. This is done by examining and identifying and inspecting from any signs of odor and the clothing of the patient. So then, observe for signs of distress, the posture or facial expression. Then observe if the patient has an eye contact during the interview and the facial expressions of the patient. Note then also the quality and the quantity of the speech. After that, note any health and illness related and attitude of the clients when examining the or performing the assessment. Then after that, also note the client's affect mood, assess the appropriateness of the client's responses, and listen for the relevance and organization of thoughts. Then after doing the assessment, document the findings in the client's record. All the assessment for the clients, you should document in the. So now we're going to assess the skin. So the first thing to do is to assemble all equipment. Then, sanitize to prevent cross-contamination. So the first thing to do in assessing the skin is inquire to the client if there is any history. So now, we're going to inquire if the client has any history of the pain and etc. So ma'am, can I ask you if you have any pain or itching? Kuan ma'am, kaning sakit or kaning katol? Na ma'am, wala. Okay. Presence and spread of any lesion, bruises, abbreviation or pigmented spot. Kay mga kuan ma'am, kanang mga samad. Wala. Okay, ma'am. Thank you. Then, skin problems ma'am. Kay skin problems ma'am. Thank you ma'am. Associated clinic signs. Ma'am, kaning sa inyong pamilya ma'am, naamoy mga problems in other family members, ng mga sakit, ng kuan. Okay, ma'am. Thank you. And nag-use po mo mga lotions, ma'am. Kanang home remedies. Yes? Okay, ma'am. Mga excessive dry or moist feel to the skin, ma'am. Then, after inquiring the client if there is any history or skin problems or pain or itching or any lesions, is first thing is to wear the gloves to prevent any forms of contaminating the client. Also, gloves can create barrier if there are any open wounds. Then, after wear the gloves, inspect the skin color and its uniformity. Then determine the skin color of the client that should be uniform to the sides of the body or other part of the body. After assessing or inspecting the skin color, we have to assess edema if present through pinching. Make sure when you pinch it, should recollect and palpate for any lesion by using your index and middle finger. Then palpate going to the upper extremities and on other side. If there are any abnormalities, you can use magnifying glass to determine the type of lesions and the properly visualize it and measure using millimeter ruler. I didn't find any abnormalities of the lesions and properly visualize the skin. So the fifth is palpate skin temperature. Compare the 2 feet and the 2 hand using the backs of your finger. Now I will going to assessing the hair, ma'am. So I will assess your hair through inquire you some of the questions. So bisayon lang na po, ma'am, para makasagot ka, ma'am, no? So first, recent use of hair dryness, rinses, or curling or straightening preparation. So ma'am, straight na imong buhok, ma'am. Okay, ma'am, thank you. Kung gikulot na po na imong buhok, ma'am, wala pa po, ma'am. So I will inspect the client's hair now for the recent chemotherapy. If there is a presence of disease, if the client is wearing a hairpin, remove it. And if the client is using wax, ask the client to wash his or her hair before proceeding to the assessment. So, ma'am, naggamit ka o buwan, ma'am, any pampagay sa buhok, pwesa ng gel. Sige, ma'am, thank you. Oh, we will remove the rubber bands or any hairpins or etc. So inspect her thickness or thinness. Then, inspect the evenness of growth over the scalp using the hand. Make sure that your hand is in C form and you are in the back of the client. The hair of the client should have an evenness distribution. Then, inspect hair texture by inserting a pressure using your thumb. Then, make sure that the hair will not full and should not be brittle. in a normal individual. And determine the oiliness, pull the hair, and ask the client to bend down his or her head, then take note of the condition of the hairline of the neck. So, ma'am, can you bend, please? Then, come on, thank you. Inspect the amount of body hair. And after determine the oiliness, inspect the amount of body hair. Go in the front of the client and determine any forms of receiving any hairlines by assessing both sides. Okay, after inspect the amount of body hair, document the findings in the client record. So now, I will going to assess the nails of the client. The first thing is to inquire if the client has any history of diabetes mellitus, peripheral circulatory disease, and previous injury, and the severe illness. So, ma'am, ma'am, I would like to ask, you have a previous injury, ma'am, kanang na kuan imong tiil, kanang na piko, or imong kuan mga nails. Okay, ma'am, thank you, ma'am. Then after inquire if the client has any history of that following, the second is inspect the finger tips or fingernails. Plate shape to determine its curvature and angle. Normal curvature should in 160 angle. Determine the angle. There should be no inward movement or motion of the nails. Third, inspect fingernails and toenails textures. Determine for any vascular disease or peripheral vascular disease. Ma'am, can I have your hands, ma'am, please? Okay, after inspecting the fingernails and the toenails, inspect the fingernail and toenail bead color. Determine also the nail plate color. Make sure that the cuticle is intact. Then after inspecting the fingernail and toenail color, perform blanch test of capillary relief. This is creating small pressure into the nail bed of the client. So, in performing the blanch test of capillary, you're going to press 2 or more nails between your thumb and index fingers. Look for blanching and return of pink color to nail bed. Ask the client if there is any pain during the test. Ma'am, I would like to ask if during in pressing your finger nails there is pain, ma'am. kining naikuan ma'am sakit kung akong ginakuan ang ginatuplok imong mga kuan ma'am nails. Okay ma'am, thank you. Then after performing that procedure, document the findings in the client's record.